our National Emergency Operations Center COVID-19 weekly briefing for Wednesday, May 5th, 2021. Thank you very much for joining us for this press briefing. We continue to update you with what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic, which is still affecting many parts of the world in a very serious way. Something would have happened between the last time we were here and now. I was administered the second dose of the Oxford AstraZeneca vaccine. I am not only the face of these briefings. I believe in the ingenuity of scientists. I believe in the work of science. Since this pandemic began over a year ago, I have been paying keen attention to what is happening. I am a journalist. I read extensively, from the New York Times to CNN to the Los Angeles Times. I'm always in the news. I do research. I read from a lot of sources. I think I am media literate. And therefore, I can only applaud the work that has been done in science and technology to bring us where we are today with vaccinations. I am proud of myself and proud of all of those who are taking the vaccine in their effort to help humanity survive. It is our only hope. It is our best shot. And today I'm happy that in 2 weeks' time, I will be fully vaccinated. I want to invite, firstly, our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center report.
Thank you, Mr. Williams, and pleasant good afternoon to everyone. This afternoon, as per usual, I'll share with you the Health Emergency Operating Center Committee's situation report for today, Wednesday, May 5th. To date, the Federation of St. Kitts and Nevis would have reported a total of 45 confirmed cases of COVID-19. Ladies and gentlemen, 44 of these cases have fully recovered, and so at present we are following or monitoring one active case who remains stable. And please note that this case, again, was imported, an imported case of COVID-19. And the individual is in quarantine as we speak. The individual would have left the airport and went straight into quarantine and was subsequently identified as a case of COVID-19. Now, based on the World Health Organization's COVID-19 dashboard, between last year, January to present, as many as 153.7 million persons have been affected and diagnosed with COVID-19. Over 3.2 million persons have died from this condition. And concurrently, many territories or countries globally have rolled out their COVID-19 vaccination programs, and to date, over 1.1 billion doses of various types of COVID-19 vaccines have been administered. In the United States of America, 32.5 million confirmed cases have been reported, and over 578,000 deaths have occurred because of COVID-19. And the numbers continue to rise in the United States of America, and it's of interest that we look at the news coverage of what's happening in India, where we see a tremendous surge in the number of cases, the number of newly confirmed cases every day, and the total number of deaths in India. In terms of vaccination, COVID-19 vaccination, as I said before, over 1.1 billion vaccine doses have been administered worldwide. And so this slide highlights the countries, some of the countries and their success rate in terms of COVID-19 vaccination. And so based on the New York Times dashboard in terms of worldwide COVID-19 vaccination, Seychelles is one of the leading countries in terms of being successful in vaccinating its population. 61% of the population there is fully vaccinated. Israel is also doing very well with 56% of its population fully vaccinated, meaning persons would have received 2 doses. In the United States of America, they have a coverage of 45% of persons receiving 1 dose and a coverage of 32% in terms of its population being fully vaccinated. In the United Kingdom, 23% of the population is fully vaccinated. Canada, 3.1%. Please note that the United States and the United Kingdom would have commenced or started on this journey from as early as December 2020. In the Caribbean region, again, we realize that the pandemic is worsening. And then the next slide provides data, specific data regarding the Organization of Eastern Caribbean States. Okay, so in the OECS territories, the 9 territories collectively, as many as 12,063 persons would have been diagnosed with COVID-19, and as many as 163 deaths have been reported secondary to COVID-19. Interestingly, today is exactly 2 weeks since Anguilla, the health professionals in Anguilla would have identified a cluster of COVID-19 cases. And so within 2 weeks, we see the number of confirmed cases in Anguilla jumping from 29 to 95 in just 2 weeks. And we also see the vaccination, the successes in terms of vaccination programs in the islands. So in Dominica, they would have achieved a coverage rate of 13% of its population being fully vaccinated. Grenada, 2.4% of its population being fully vaccinated. And then in terms of the first dose, we could see what's happening in Barbados, 26% coverage, Montserrat 22%, St. Lucia 13%, St. Vincent and the Grenadines 13% in terms of the administration of the first dose of the vaccine. In St. Kitts and Nevis, the slide that you are looking at shows the data as at yesterday, the end of day, work day yesterday, in terms of the number of vaccine doses administered. But let me just back up. Now, Monday made 10 weeks, exactly 10 weeks since we would have launched our national COVID-19 vaccination plan. And so yesterday, we officially started the drive in terms of the administration of the second doses of the AstraZeneca Oxford vaccine. And so as at end of workday today, Wednesday, May 5th, 13,000 over 13,000 vaccine doses have been administered, or as many as, 39.5% of the target population has been covered with the first dose of the AstraZeneca Oxford vaccine. And then, up to today, over 220 persons would have received their second shot or second dose of this vaccine, or a coverage of 0.7% of the target population. We continue our surveillance, COVID-19 surveillance. So in other words, anybody who presents at the emergency room, JNF or Alexandra Hospital, exhibiting COVID-like symptoms, they are evaluated, they are tested. And so we continue testing and monitoring such individuals. So to date, over 13,000 persons would have been tested with a mere positivity rate of 0.3%. This slide shows that we have 44 cases recovered, one in isolation. I want us to pause here to highlight the fact that today, 2 charter flights would have landed with yet another batch of students for the Ross University School of Veterinary Medicine. And so a total of 105 students would have landed today. And they would have left the RLB International Airport en route for the dorms on campus, where they will be in quarantine for a total of 14 days. They will be tested upon arrival. They were tested prior to coming to the Federation. They are going to be tested on arrival as per usual, and then they will be tested at the end of their quarantine period. And so today, again, we continue to update the public regarding our Oxford AstraZeneca vaccine and our COVID-19 vaccination plan, just to underscore that once you are fully vaccinated with this vaccine, you would enjoy an 83% risk reduction in the ability in your ability to pick up COVID-19. So very, very few persons who are fully vaccinated do contract the disease. They call them breakthrough infections. And what the literature suggests is that this would only happen to individuals under 2 main circumstances. One, if you are in contact or interacting with individuals who are positive. So in other words, if you're in a setting where there is an outbreak or clusters of cases, then you run the risk of a breakthrough infection. Or if perchance you are fully vaccinated, but you are not adhering to the COVID-19 prevention measures. So in other words, you're not wearing your face mask, and if you falter in terms of your hand hygiene, and if you are too close to strangers in public spaces, then the risk of a breakthrough infection will occur. So in other words, once you're fully vaccinated, the risk of you picking up COVID is quite slim. And so it also highlights the need to continue the COVID-19 prevention practices that we've been advocating all these months. We are providing this vaccine to adults, persons over 18 years. Next. And so this slide just summarizes the post-vaccine symptoms, tenderness at the injection site, feeling cold, mild fever, relieved by paracetamol. And so with respect to the over 13,000 persons who have received this vaccine locally, just minimal side effects. So there is a fairly good side effect profile related to this virus. And this is based on our local experience in the Federation. All right, so just again to reiterate the benefits of this vaccine, it's approved by the World Health Organization, it's effective. As I said before, it provides a good protection in terms of a reduction in risk in terms of picking up the disease. It prevents you from severe illness and hospitalization and death. And based on the studies, the data coming out of the trials, this vaccine works quite well in older adults, persons who are 60 years and over. So it's quite safe and effective when it's administered to older adults. Next. It provides some protection against the variants of concern. So, ladies and gentlemen, there are quite a few SARS-CoV-2 variants of concern that are emerging. So we know of the variant identified in the UK, South Africa, Brazil, and then just over the past few days, we are learning about the double mutant variant that has been identified in India. And well, work has to be done with respect to this new variant, but based on the information we have, the AstraZeneca Oxford vaccine provides some level of protection against most of the variants of concern. This vaccine also is associated with a reduction in risk of transmitting the virus. So there's a reduced risk of picking up the virus, and there's also a reduced risk of transmitting the virus if you do pick it up. And again, this vaccine has had a very extensive global reach, with well over 142 countries globally utilizing this vaccine in terms of their domestic COVID-19 vaccine rollout plans. Now, last week, Tuesday, the Honorable Prime Minister, Dr. Timothy Harris, would have announced some policy changes in terms of our health and travel protocols in the first instance, and along with some other changes. And I'll just give a quick summary. And so one, there is a reduction, well, inbound passengers who are deemed fully vaccinated, meaning if they would have received either of these four COVID-19 vaccines, that's the Pfizer-BioNTech, the Moderna, the AstraZeneca Oxford vaccine, and of course Johnson Silacs, Johnson & Johnson. So if an inbound passenger is deemed fully vaccinated coming into our country, they can enjoy a reduction in their quarantine period, reduced from 14 days to 9 days. Please note the definition of being fully vaccinated means that you would have received the full dosing regime of the vaccine that you would have taken, and then 2 weeks would have elapsed between the last dose of the vaccine and your date of travel. Ladies and gentlemen, the COVID-19 pandemic disrupted school in the Federation of St. Kitts and Nevis in 2020, and some of this disruption continues even to present. For example, the Washington Archibald High School and the Bastia High School, there is still a shift system or program in place at these two high schools, whereby students are assigned to morning shift or afternoon shift. And this really means a shortened time in which to cover the curriculum. So in other words, our students have lost significant time in terms of covering their academic curriculum, and some students are struggling with learning during these challenging times. And so it's with this backdrop, ladies and gentlemen, I'm encouraging our adults in our population. We are encouraging the parents in our population. We are encouraging the adults in our population to come on board and accept the COVID-19 vaccine, because in doing so, you are really helping us to keep our children in the classroom. This is very, very important, because if the adults come on board and accept the vaccine, and we are able to achieve the herd immunity threshold of 70%, then if perchance there are clusters of cases or community transmission, the risk of spread of the virus would be much reduced, and then we may not have to close schools down. We may not have to revert to virtual or remote learning. And so, ladies and gentlemen, indirectly, if you come on board and accept the vaccine, you will be helping to keep your children, our children, in the classroom. The fully vaccinated persons, you still have to go online, the KNA travel form, you still have to submit a negative RT-PCR test done 3 days prior to travel, and then, as I said, your quarantine period will be reduced from 14 to 9 days. Effective May 20, again, fully vaccinated spectators will be able to access venues of amateur and recreational sporting events. So, for example, football match, basketball, athletic meets. However, the following requirements must be adhered to. One, the spectators must maintain hand hygiene, especially at entrance to the sporting event. You must wear your face mask, and then the event organizers will be asked to adhere to the 50% spectator capacity and maintain a registry of names and contact information of all the fully vaccinated spectators who would be admitted to the venues. And of course, we'll expect that temperature checks will be done on entrance. Please note that the organizers of these fully vaccinated sporting events must first seek approval from the Ministry of Sports and the Commissioner of Police. Next. Again, the PM, Honorable Prime Minister, would have announced that there is an opportunity for organizers of fully vaccinated cultural and entertainment events to target fully vaccinated patrons, and the start date for this is July 19th. Again, patrons, the fully vaccinated patrons must maintain hand hygiene, temperature checks on entrance. Patrons would be asked to wear their face mask, and we expect that there would be a registry of names and the contact information of patrons at the entrance, and the organizers would be asked to adhere to the 50% patron capacity. Again, such events the organizers must seek approval. This is just to bring to the public's attention that there is a travel advisory for travelers from Brazil, UK, South Africa, and India. These are the territories where the public health specialists would have identified the SARS-CoV-2 variants of public health concern. And so it's with this backdrop that we are asking tourists who are intending to travel from these aforementioned destinations to you are advised not to travel to the Federation at this time. However, our citizens and legal residents who are returning from these countries, you will not be denied entry. However, you must go on the URL I highlighted on the slide, www.knatravelform.kn, and complete the entry form and provide us with all the documents, the required documents. However, upon arrival, you will obviously have to provide us with a negative RT-PCR test done within 3 days of travel, and then you'll be screened on arrival, and then you will only be allowed to quarantine. This is strict quarantine for 14 days. Ladies and gentlemen, protect yourself. Let us protect ourselves from COVID-19 by accepting the vaccine. Hashtag vaccines work. Hashtag do not wait. Vaccinate. Very important. Let me underscore. Do not wait. Vaccinate. At present, we have a number of vaccine doses available to the population, but the shelf life of these vaccines limited. In other words, we must utilize the present stock of vaccines that we do have by, on or before the end of June. So do not run out of time. Do not wait. Vaccinate. Thank you.
Thank you very much, Dr. Laws. Before I introduce Mr. Samuel, I just want to mention that there is a pandemic, another pandemic that is taking the world by storm. And it is the pandemic of disinformation and misinformation and malinformation. What do I mean by that? Disinformation is false information. It is false information that is intended to hurt, intended to harm, whether persons, groups, organization, a country. It is intended to do harm. Misinformation, on the other hand, there's a slight difference. It is also false information, but the intention is not to harm or to hurt. And malinformation is real information, but with the intention to hurt or to harm. There are some of us, the only thing that we are seeing and reading are the negative things that are forwarded to our WhatsApp and on social media. Those are not the only sources. And we must do fact checking. We must check our facts. We must look at our sources. Are they credible? We must look at the reliability of information. Check one source against several other sources to find out whether something is true and the validity of that information. We just don't be gullible at every information that comes to us on social media. And in that way, we are being media literate. We are being critical thinkers and not believing everything that we read. The other day, somebody sent me something saying that the CDC, a number of persons vaccinated, this report, and from those vaccinated, so many had been infected with the COVID-19 and so many had died. And I said to the person, is this true? Let me go and check the CDC website. When you go to the CDC website, there is no such thing. Besides, I had not heard it anywhere in mainstream media. And so therefore, we have to be discerning in terms of the information that we are being fed. Otherwise, all we are going to be getting is the negative and the negative and the negative. But I took consolation in the fact that after over 7 million persons had been vaccinated with the Johnson & Johnson vaccine, just 6 persons had shown some rare blood clot out of over 7 million. That is negligible. And they paused just to make sure of what is happening. And I say, wow. These scientists, the science and everything, they are not making any joke. They are making sure that these vaccines are safe to use. They are not playing with human life. And we must look at these very factors. I now invite Mr. Abdia Samuel, who is the chair of the National COVID-19 Task Force and also the National Disaster Coordinator, to speak to us.
Thank you, Mr. Williams, for your introduction. I think the general public is getting your message loud and clear. Good afternoon, all, and thank you for listening by all means. This afternoon, I want to bring to your attention what we have done in terms of the national response to the La Soufrière eruption in St. Vincent and the Grenadines. But most importantly, I'm happy for the special guest that is going to be joining us today to give an update. To date, St. Kitts and Nevis has contributed 5 containers of relief supplies to St. Vincent and the Grenadines, 2 40-foot containers and 3 20-foot containers, and 2 of the 3 20-foot containers would have come from the island of Nevis. Those 5 containers, would have amounted to approximately $280,000 worth of relief supplies. I also wish to inform you that we are in the process of negotiating one 40-foot container to be sent to St. Vincent and the Grenadines in the upcoming days. As soon as we have finalized the terms and conditions of agreement for sending this container, we will communicate with the general public for those who may have some relief items to send to St. Vincent and the Grenadines. I also wish to notify the general public by this means that persons who are within the 9-day category for quarantine at the OTI, again, I repeat, at the Ocean Terrace Inn, will now pay $320 US for the duration of the 9-day stay. Again, I advise persons going to the Ocean Terrace Inn, that's the OTI in quarantine facility, they will now pay $320 for the 9 days of quarantine. Please be guided. There was a viral video that was being shown by some persons who would have hiked to the crater at Mount Lyamiga. Again, I want to reemphasize the St. Kitts and Nevis preparedness measures when it comes to any potential volcanic hazard. Therefore, with this presentation, I will provide you with some background, and then we will have the director of the UE Seismic Research Center joining us live from Trinidad this afternoon. Right, so Mount Lyamiga, as we call it, the crater, where persons use it for leisure and pleasure, hiking, and also descending down into the crater as a means of pleasure. Mount Lyamiga, as we know it, Mount Misery, is the only live volcano in St. Kitts. Again, the volcano is dormant but alive. According to the history, the most recent major eruption would have occurred 1,600 years ago. However, the historians have also indicated that it is possible that two eruptions would have occurred in 1962 and 1843. Now, the continuous hot springs activity and occasional bursts of shallow earthquakes directly beneath the volcano means that the volcano is still alive. And this information is based on the assessment that was done by the UE Seismic Research Center. On Nevis, there is an existing volcano in Nevis. The entire island of Nevis is a single volcano, with Nevis Peak being the main volcanic center. There have been no recent sign of increased volcanic activity on Nevis. However, frequent shallow earthquake swarms, meaning a series of earthquakes, and the existence of hot springs activity associated with Nevis Peak indicates that the volcano is alive and can erupt in the future. Now, volcanoes have geothermal activities associated with them, and we do enjoy some of these geothermal features associated with volcanoes. On Nevis, we have two local geothermal activities, in that of Cades Bay Soufriere and Farm Estate Soufriere, which you will see minor fumarolic activities. In addition, there are areas that are pervasively hydrothermally altered rock present through the island. For example, Clark's Gut and Nevis. Also presently in Nevis, you will see a number of hot springs, and though the hottest being those at Bath Estate and at Cades Bay Beach. Currently, geothermal activity is largely concentrated on the western half of the island, and we are speaking about Nevis. Now, how do we prepare? Is St. Kitts prepared? Let's speak about the hazard mapping and the disaster preparedness for any potential volcanic hazard. The Seismic Research Center scientists provided advice, as well as They have, as well as producing maps and other public information material to enable the general public and the national authorities to better prepare for future volcanic eruption. Being prepared for these events can considerably reduce the risk posed to you and your families, what we usually say, lives and livelihoods. Now, this is an image of the volcanic hazard map. You will see you have the orange color, which indicates the very high risks. So you need to become familiar with the area in which you live and see whether you fall in that category. Then we have the orange, or well, basically here it looks more brown, mustard-like color. And this is the high-risk area as well, where there's a likelihood for heavy ashfall. Then we have the medium-risk areas, which is identified in the yellow. And this area is likely to produce frequent and significant ashfall. And then we have the lowest hazard area, what we call the low-risk area, and that is the southern part of St. Kitts and Nevis, halfway between Bastia to the Southeast Peninsula. So those are the classifications of the color coding for St. Kitts and Nevis. For example, in St. Vincent and the Grenadines, you hear about the red zones, persons who are in the red zones, the orange zones, etc. This is the same process that is being applied to St. Kitts and Nevis. However, on Nevis has two color codes because of the build of the way Nevis is built. The Nevis has orange, sorry, it should be red and orange, meaning that if there's any explosion on Nevis, eruption on Nevis, sorry, the entire of Nevis has to be evacuated. Right. So, hazard mapping and disaster preparedness, it's important for you to know, do not wait. Do not wait for an eruption to occur to start thinking about preparedness. I just indicated to you the different risk levels that are associated with the various areas in St. Kitts and Nevis. So don't wait, prepare. Know where Mount Lyamiga and Nevis Peak is in relation to where you live. Know what to do if an eruption occurs. And a volcanic eruption may happen in your lifetime. Now, how do we know if something is going to happen? We have volcanoes. Volcanoes don't usually erupt suddenly without warning. They are normally preceded by clear signals which one recognizes and enables timely warnings to be issued. For example, in St. Vincent and the Grenadines, and I will leave that for our colleagues in UWI Seismic Research Center to bring it to your attention this afternoon, but there was a swarm of earthquakes that indicated that movement of the magma. Now, we are monitoring the the volcano at Mount Lyamiga. And the monitoring of this is done through a number of monitoring systems and sensors that we have around St. Kitts and Nevis. So what will happen is that if there's any challenges or any risk or hazard that the volcano is going to pose on St. Kitts and Nevis, we will have an increase in the number of shallow earthquakes beneath or near the volcano. 2, the swelling of the flanks or slopes of the volcano, they will start to swell. And we saw that La Soufrière actually developed another crater. Changes in the chemistry of the gases and hot springs associated with the volcano. So these are 3 critical things that we will see. Now, the UWI Seismic Research Centers, what they have is they have GPSs, what we call global positioning systems, that will measure, that will take measurements and track the ground deformation, the swelling or deflating of the volcano flanks. And also, the chemical composition of hot springs and gases is also monitored through time, as changes in chemical properties may indicate a change in the volcanic activity. With that said, I have provided you with some information due to some activities, well, the viral video that was going around, and now I will have Mr. Williams introduce our colleagues from the UE Seismic Research Center. Thank you.
We'll invite Dr. Erosilla Joseph. I hope I pronounced that name correctly. And Dr. Joseph is the head of the UE Seismic Research Center at St. Augustine, Trinidad. She has been the one who has been giving the daily updates on what is happening with the La Soufrière volcano in St. Vincent and the Grenadines. We now invite Dr. Joseph to give us her presentation.
Thank you, everyone, and good evening. So I don't have a presentation per se, but I do intend to address the information that was shared from the video on Facebook, and to provide some information to your listeners, to the listeners on some of the current activity and what it means. So many of you would be familiar with the video, and what it did show is people in the crater of Liamiga with the hot spring, with the hot spring areas and showing the bubbling and so on. Now, as Mr. Samuel indicated, every volcano that can erupt again, we consider to be live. I know many of you are familiar with the word dormant. That is something that, as we learn more about volcanoes, we learn new terminologies and things that are phased out of use. So dormant is actually one word. When I was in school, I used that word. But scientists are now trying to get away from the word dormant, not because it's wrong, but more so that it gives people a false sense of the volcano not being able to do anything, that it's dead. So people often mix up dormant with dead. So we tend to stay away from the use of the word dormant, more recently. So Liamiga is considered live, and that means that it has the potential to erupt again in the future. And I think Mr. Samuel summed it up very well in his presentation, where he showed that a volcano is considered live when we look for certain signs. And those signs are seismic activity that are associated with the volcano. And how we see that is we detect the earthquakes, and they're located beneath the volcano and around the volcano. And this is what, as he indicated before, some of the signs that we saw with La Soufrière and St. Vincent. The other sign of activity, or that a volcano is live, is the deformation, as he mentioned, and this is the swelling, because as fluids, and this could be either magma or gas, rise or beneath the volcano, it causes the volcano to swell like a balloon. And with the ground deformation network, that is able to detect these changes in the shape of the volcano. And it allows us to see whether or not that is happening. And the other tool is the geochemistry, which is the thing that I think is most of interest right now, in that we look at the changes in the gas and the water chemistry. And actually, that's something that I do at Seismic. The activity that was seen in Liamiga is normal. It's not unusual. It does not look any different to what has been seen in the past, in terms of how the feature looks and the type of activity that's associated with these features that are in the crater. As a matter of fact, in other volcanoes or volcanic areas such as Dominica and St. Lucia, you would see even more, I don't want to say violent, but more effusive activity associated with their hot springs and fumaroles that would actually look a lot more active than what was seen in the video for the monthly Amiga features. But at the same time, we must be aware that it is a live volcano, and there are safety concerns with people going in and not being able to get out because, as was mentioned by Dr. Brown in his update on the umbrella, it is a challenging, physically challenging hike, and there is a risk of injury. But just to note that what is a, to go back to the question about what is a geothermal system and why does it show these signs at the surface. So what happens is, yes, there is magma at depth beneath the volcano. What happens is it heats the rock above it. So this hot rock is there. And then you have water coming in from the rain that filters through the cracks and so on the volcano, and it percolates down into the earth and is heated by the hot rock. The magma itself also degasses, so there's gas associated with it, and together with that hot water that's heated up and boils, that comes up to the surface and is manifested as the hot springs and the vents and the fumaroles that we all keep referring to and hearing these words. So this is something that's seen in most volcanic systems. And of course, when a volcanic system becomes more active, you would tend to see changes in the activity as well as the appearance of these features. And this is not what is happening at La Amiga. So the other thing is seismicity wise, I think we need to kind of understand that there are two types of two types of earthquakes. There are what we call tectonic earthquakes, and this is associated. We live in the Caribbean, and we live in a subduction zone setting, and that as the plate moves, meaning the North American plate, as you all know, are being maybe aware, is being subducted beneath the Caribbean plate, and this gives rise to the volcanoes in the arc that creates the volcanic islands of the arc, and it also is responsible for the earthquakes, the big earthquakes that we feel, the tectonic earthquakes. So this is when the plates slip, and it doesn't slip very smoothly. It slips, as pressure builds up. It's jagged rocks. So when they slide past one another, and that sliding is not smooth, it creates these earthquakes, and that's tectonic earthquakes. But many of you who are following the La Soufrière event eruption would become a little more familiar with the other types of earthquakes which are associated with volcanoes. And namely, these are long period earthquakes. There's long period, there's the tremor that we talk about, and there's volcanic earthquakes or VTs, volcano tectonic earthquakes. So the volcano tectonic earthquakes, that's the first sign that we would start looking for. And these have specific signals that we would, or seismologists would be able to interpret. And the volcano tectonic earthquakes, these are the ones that are generated when magma is trying to find a pathway. So what it does is it breaks the rock up above it. And this breaking and fracturing of the rock generates a certain signal, and this is seen as VT earthquakes or volcano tectonic earthquakes. And then when that pathway is created, then that fluid, the fluid magma and the fluid gas, is able to move a bit more freely through the volcanic plumbing system. And that is seen as what we call the long period earthquakes. So think of it like a straw, and the vibrations that the liquid, whatever you're drinking, makes when it contacts the sides of the straw, that generates a signal, and that's similar to what we see when we see the long period earthquakes, and that's an indication that magma is moving closer to the surface. And these are the type of information that we used to help. And now to go back to another thing, we cannot predict volcanic eruptions. What we do is provide forecasts and warnings. So in terms of the actual date, place, and time, that is not something that can accurately be predicted. There is some level of uncertainty, but our aim is to provide enough warning to be able to, as Mr. Samuel and everybody has indicated, to try to save lives and to allow evacuation of people if necessary to avoid harm. So with respect to that video, if we go back again, the type of activity that was seen is a normal hydrothermal activity. It was not unusual for the Amiga, and it does not indicate that there is an increase in the activity of the volcano. The other concern that people often say is that when one volcano erupts in our region, it's linked to other volcanoes, and other volcanoes can show unrest. That again is not true. The processes the processes throughout the region that actually allow for the formation of the volcanoes, that's the same. Yes, it means that we are in a subduction zone, as I mentioned before, and this is what allows the formation of volcanic islands. But in terms of the plumbing systems of the volcanoes being linked, no, each volcano is different and has its own plumbing system, and one activity at one does not necessarily allow for another one to increase in activity or erupt. So I hope that this addresses some of the concerns that you may have. There is a lot of information being provided on our social media platforms, the Facebook page, Instagram, Twitter. And if you have any questions, you can certainly email us as well, or send a note in any of those social media platforms, and we can answer them. But utilizing the eruption at La Soufrière, we've tried to share as much information so that the public are aware of these terms and can understand what is happening. And I think one of the key things that Mr. Samuel said was preparation. So this is not meant to scare anyone, but we all live in volcanic islands, and we use them. We use them for recreation. We utilize the resources that they provide, tourism and other things. The forest, the plants, the trees, etc. But we must also be aware that there are associated hazards with them, and preparation is the key. So knowing where you live, knowing which zone you are located in, the evacuation routes, ensure that you listen to the official sources of information, such as the NEOC, the Disaster Agency of St. Kitts and Nevis, as well as the Seismic Research Center, the monitoring agency for St. Kitts and Nevis. So hopefully this information may be of assistance.
That explanation in terms of what is happening at our volcano. Of course, we know that, again, people are sending around things. People want hysteria. They want excitement and all of that. The doctor mentioned to you where you can go as an official source to get information. And that is what we must do. Speak to people who are officials and authorities on particular subjects, and go to the relevant sources to get information. That now brings us to so thank you very much again, Dr. Joseph. That brings us to the question and answer segment. And our first question, Seychelles, that beautiful place, which has fully vaccinated more of its population against the coronavirus than any other country, has closed schools and canceled sporting events for 2 weeks as infections surge. How is this if they are at herd immunity? Dr. Wilkinson.
Thank you, Leslie. And I think that we can learn a lot from what is happening in the Seychelles, because number one, they have a population of about 98,000, which is just twice what we have here. And so we can compare what's happening there to what's happening here in St. Kitts. Now, yes, they are the country that has vaccinated the most persons in the world, about 62%. You heard the CMO just said that. And despite that, they had a recent outbreak starting at the end of April, where they experienced, I think, is about 456 new cases. Now, when you study the report that came out, it said, number one, about 84% of these persons were locals and 16% were foreigners. But of the total number of new cases, more than 2/3 of them were persons who were not vaccinated or only received their first dose of the vaccination. And the outbreak occurred after they had relaxed their non-pharmaceutical measures during the Easter celebrations that they recently had. And so what this tells us is that even though one could reach herd immunity, I said before, it is not an on and off switch. You don't reach to herd immunity and stop social distancing, stop wearing your mask, drop all of your quarantine and procedures, because there is still a certain number of persons in the population who would not be vaccinated, and they can start clusters and they can start spread. We, however, are reassured that countries like the UK, that have vaccinated about 52% of their persons with the first dose, have experienced a significant drop in new cases, and Israel, which you heard about, they have experienced a 99% drop in new cases. And so the lesson to be learned from that is that, yes, we need to move to herd immunity, but we need to continue the non-pharmaceutical measures that has kept us safe thus far, and everyone who should be vaccinated or who is supposed to be vaccinated should go forward and get vaccinated to protect us all. Thank you.
Thank you very much, Dr. Wilkinson. Dr. Joseph is holding on for questions. If anyone in the public has questions that they want to pose to Dr. Joseph, she is holding on, and she will answer those questions if you have any. Dr. Joseph has been working with the Seismic Research Center since August 2002, and she's from Trinidad. The second question: at the rate of which we are vaccinating, is there really any realistic hope of us getting to herd immunity voluntarily? Dr. Wilkinson.
Well, I think I was sitting next to the CMO at Leadership Matters last Tuesday, and she said that at the rate at which we are going, we will not get to herd immunity until next year, you said? Next year. And so, yes, the rate has slowed significantly, and if we are hoping to open the economy this year in October for the upcoming tourist season, we cannot continue at this rate and get to herd immunity while one appeal to persons and hope that they will do the altruistic thing and come forward and get vaccinated, not just to protect themselves, but to protect others. I believe that if we just go on the voluntary basis, we will not get there. And so the question is, how do we get to herd immunity? I have said before that we need to focus on developing little herds also. And so one can have little herds in businesses, in churches, in your home, in schools. And so we encourage every single person who has some degree of control over the groups that come in contact with them to encourage them or to nudge them or to give them a little push to make sure that they get vaccinated. I was very happy today. As a matter of fact, there's a lady who I gave a big hug today, and if she's listening, I know she know that I'm talking about her, because she was very much against the vaccine and kept telling me that the Lord was going to protect her. And she came to me today and told me that she got vaccinated. And I said, yes, you finally changed your mind. She said, well, her boss told her that in the interest of herself, the country, the hotel that she works at, it was important for her to get vaccinated, and she went forward and she got vaccinated. So there are a number of different reasons why persons will go forward and get vaccinated. I urge you to do the right thing and step forward and get vaccinated.
Thank you, Dr. Wilkinson. The next question, how does things change for persons that are fully vaccinated? For example, some persons have received their second dose of the Oxford AstraZeneca vaccine and will be fully vaccinated within 2 weeks' time. Dr. Wilkinson.
I will just personalize what the CMO presented when she spoke about the benefits of the AstraZeneca vaccine. So I'm very happy that I received my second dose yesterday. I saw Leswai was there also for his second dose. I'm happy that the cameras weren't there to see him crying when he got his injection, okay. But he got his injection nonetheless. And so in 2 weeks' time, we would be fully vaccinated. And by being fully vaccinated, I know now that I have a significant decreased risk of becoming infected and transmitting the virus to other persons. And so when I come in contact with children, with the elderly, with persons in nursing homes, if I go to the prison, persons in institutions like that, I know that my risk of transmitting the virus to them is significantly decreased. I know that by being fully vaccinated, my chance of getting serious disease and being hospitalized from COVID-19 is significantly decreased by 83%. I know that if I were to get COVID-19, the chance of me dying from COVID-19 is almost negligible. And so there are benefits to the individual and to the community for someone getting vaccinated. Some persons, they ask, well, what's in it for me, as if they think that, well, once you're fully vaccinated, we're going to tell you you can go wherever you want, take off your mask, etc. It is not like that, because the actions of everyone affects all of us. And so until we get to a significant threshold, we will continue to use the non-pharmaceutical measures. However, if you're in a group, a family setting, or a group of friends where you all are vaccinated, the WHO and CDC has said that you can relax the social distancing measures and even socialize without a mask. And so those are the things that I'm looking forward to doing, socializing with my friends who are fully vaccinated with some relaxation. Thank you.
Thank you very much, Dr. Wilkins. That brings us to the end of our question and answer segment for today. I want to thank all of you. I thank Dr. Wilkinson. I thank the CMO, Dr. Hazel Laws. I thank the Honorable Wendy Phipps, who is often here supporting us here at the NEOC. Dr. Christmas Jacobs, we thank Superintendent Cromwell Henry, who took a break from presenting today. Mr. Abdius Samuel, ZIZ, and everyone who is partnering with us here at the NEOC. We also thank Vesta, and we thank Rebecca's Catering for the cake and so on that we were provided with last week for the birthday. We also thank Dr. Joseph, who is the head seismologist at the UE Research Center in St. Augustine, Trinidad. We thank as well Ophelia Blanchard, who works here and contributes invaluably to the NEOC. We thank all of you for joining us today for this press briefing. Next week we'll be back. Until then, take good care and observe the protocols and get vaccinated.